Welcome to Local Omaha. I'm Ken Bartholomew.
And I'm Kelsey Wiedel.
With each program, we bring business owners, community leaders, nonprofits, and entrepreneurs. And this week, Kelsey, our guest.
Yeah, this week I'm so excited to welcome Jenni Haan from Aspire Health. Thanks for coming in, Jenni.
Thanks for having me.
Hi.
So Jenni, I'm going to get it started, and I'm going to say I'm looking at your website, and it says that you provide high-quality telemedicine services that empower your patients to take control of their health and well-being. So what does that mean?
That's a lot. I think that's SEO guided, right?
Yes.
I'll give you just a little bit of a history so you know where I'm coming from. So I'm a PA. I graduated in 2005. I got my foot on the ground in family medicine for about 8 years, which was a nice overview of everything. I was lucky enough to train under a doctor who was functionally medicine trained at the time, and so I like to take more of a holistic or natural approach to medicine. And then around 2013, I totally pivoted, went to the hospital and took care of only sick patients for the next 10 years or so. In 2022, kind of started realizing like all these patients are coming in and losing massive amounts of weight, and how are they doing it? And kind of started trying to put the puzzle pieces together and realized all of these folks were on Ozempic. And so quickly wanted to get some for myself. I'm a mom of 4. It's always, you gain weight, have another baby, lose weight, have another baby. It's just, always a lifelong struggle. And so realized quickly that the Ozempic at the time was $1,400 a month, which obviously, is not affordable. And so found a compound version of semaglutide at the time, started on it myself in April of 2022. And then it wasn't even maybe 2 months later that I was sitting late at night in the hospital medicine office and saying, like, we're in healthcare and we didn't even know about this. And like the whole world doesn't know about it. We need to do something about this and try to, get it offered out to people. So the dream was born, and in the middle of the night to launch a telemedicine practice. It was kind of say like COVID is the only thing that kind of allowed telemedicine practices to be, commonplace. It kind of made that acceptable. And so out of the box, launched a practice in July of that year, and it took off like, lightning, which was wonderful. And here we are now almost 4 years later. So, so telemedicine only, so we don't have a brick and mortar location. We serve, obviously, Nebraska and Iowa. Those are kind of our bread and butter states. That's where most of our patients are, but we have expanded over the years, and now we're in, I think, 33 states, last count. So,
wow.
And we offer a variety of services. So we still do weight management. That's definitely what we're best at. And then along the way, we've realized like, oh gosh, now you've lost all the weight you wanted to lose. Let's take a look. What are your hormones doing? Maybe you need to optimize your hormones. So we've added on hormones to that, and then functional medicine, which functional medicine is a little bit more of a deeper dive. Like you might go to your regular doctor and get yearly labs, and they'll hand you a couple of prescriptions for something, but they may never be looking a little bit deeper than that under the surface. So we try to do root cause analysis basically with functional medicine. And then most recently, about a year ago, we've added on more peptides, which the weight loss medications are peptides. And now there's a whole explosion of other peptides out there. So we've learned about them, and now we're offering some of them to our patients as well.
I feel like you must have spent the last 4 years learning something new every single day, because Jenni was one of the first people I had ever heard of or had even had rumored of. You were way ahead of the trend. I mean, I feel like, we're seeing these commercials left and right nowadays. You guys were really on the cutting edge, and stuff changes every single day. So you're really having to keep on top of new medications and new authorizations and things like that. How is that going for you guys? I mean, you must be the master of being not only a medical professional, but pivoting in business as well.
Right. I don't recommend it to anyone. I'm like, if I had to do it over again, would I? I would, because we've helped so many patients, but it's not been easy. When we first started out, it was the year Mounjaro came out in 2023, and there was this $25 Magica coupon, and anybody could get it. Didn't matter if they had diabetes, no diabetes, obesity, like we're sort of giving it out,
Yeah.
obviously with medical screening, but giving it out to a lot of patients. And so everybody got on it and it was working and it was fantastic. And blood pressure was going down and, heart disease is being reduced and sleep apnea is improving, all of these wonderful things. And then, of course, the pharmaceutical company put a big squash on that coupon near overnight, actually.
Yeah.
And so that left everyone scrambling. And so we kind of pivoted to compound versions at that time. Compound medications are essentially made in a compound pharmacy. There are probably thousands and thousands throughout the United States now that do this. They follow specific guidelines. They're called Compounding 797 guidelines. They are not FDA approved versions, but they do go through a testing at a third-party lab to make sure it's the actual molecule they're saying it is, to test for potency, and then they also screen it for bacteria, obviously, because we want to make sure that we're giving out,
Quality.
yeah, absolutely,
I
absolutely.
think that's really important. I'm so glad you said that because I wouldn't have thought to ask that. I think some people are very hesitant to do compounded medications, which actually I don't feel are new. They've been around for quite a while
Right.
for other types of medication, but it might make someone more leery. So completely safe option for somebody who might be considering something
Yeah,
like that.
I mean, I take compound versions myself. I always tell patients the first 2 scripts I sent in were for my mom and dad, and I love them dearly, and I don't ever want anything to happen to them. We take safety very seriously. We monitor our pharmacies. We have a handful that we use now, but monitor them regularly. They are inspected by the FDA, so we don't work with any pharmacies that have any sort of FDA write-ups of any sort, and we're really careful to always put safety first.
So who is a potential patient, or is it patient, client?
We call them patients. 'Cause
Okay.
yeah.
Well, I mean, if there's somebody who's like, oh, I'm at this, let's just say 9 to 13 pound weight loss
Sure.
goal. No, but is it somebody who's coming in that really has, is it 100 pounds? I mean, what is it, of all sizes or goals, or how's that work?
Yeah, it's a great question. So when we first started out, we did follow the kind of branded medication guidelines, which meant your BMI had to be over 30 or over 27 with 2 risk factors. Risk factors being high blood pressure, high cholesterol, sleep apnea,
Okay.
that sort of thing. What we found is that there are so many benefits of GLP medications above and beyond weight loss. So less inflammation. There's some thought to be some neuroprotective benefits. A lot of these studies are still ongoing. It's being looked at for alcohol abstinence and drug
All sorts of
abstinence.
addiction.
Yeah. It's really, really cool. So patients with like irritable bowel syndrome seem to have that kind of even out. I've got several patients who have low blood sugar who keep nice and even when they're on a GLP, so they don't have those drops. They don't have to pull over when they're on the side of the road and, have a snack, worried about driving home. So tons of benefits above and beyond just the weight loss. So to answer that, we have gone into lower BMIs at certain times, just depending on the patient. And we do what we call microdosing now. Microdosing is really just a buzzword for a tiny dose. And some of those patients might just take, a fifth of the regular dose in order to control, any of those things like inflammation, autoimmune issues, and so forth. So,
Oh,
Wow.
yeah.
Is that something you see people doing for long time, kind of maintenance? If somebody's coming in and, they've had success with GLP-1s, but they're not really looking to maybe lose more weight, but kind of maintain while also getting these other health benefits, would you recommend something like microdosing to them, or how do you deal with that maintenance?
Yeah, that's a good question too. So what we do with our current patients, we have 2 programs. One is called Lose It, where they're actively losing weight, and then we have a program called Lost It for our maintenance patients. When our patients get to their weight loss goal, we put them over to Lost It, and then we start slowly decreasing that dose and then maybe spacing it out. So maybe instead of every week, you take it every 10 days or every 14 days. And then same with our fresh patients coming in that maybe don't have a whole lot of weight to lose. Maybe they want to lose 5 pounds of menopausal weight or something along those lines. We'll microdose and use either a spread out schedule. Sometimes we actually do it twice a week, depending on the needs, but usually much smaller doses. So the truth is, if these medications were affordable, we'd probably just dose them every week at a little bit lower dose. I always think less is more, and we want to obviously put as little of medicine into our body and use nutrition and exercise and so forth.
Sure.
But the medicine has just been such a fantastic tool.
Wow. I think that's one thing. Oh, I'm sorry. Go
No.
ahead. I think that's one thing that also makes you, your business specifically unique from a business perspective, is you have quite a comprehensive program available. So not only do you offer, weight loss medications, but you also offer all of these labs that you can order to see maybe what your underlying causes would be. And you also have your 2 programs that you just talked about. Tell us a little bit more about what that entails for someone who is looking to get on the medication, but also kind of make lifestyle changes as well, possibly.
Mm-hmm.
What do you guys do for that?
Yeah. So as we've kind of said, like there have been just places popping up all over the place. There's huge national companies doing this. Not everyone's giving the same quality of care. And that's one place that I would shut down before I would sacrifice that. So we check labs on every patient before they start GLP medications. The amount of things we found, low thyroid, high thyroid, cholesterol levels in the, 8 to 900s. Not me personally, but my one of my former partners at the hospital, she had a patient with actually failing kidneys, and he started dialysis the next week. So lots of these national places don't check labs ahead of time. We feel really strongly that it's important to check them and then monitor them throughout. Lots of undiagnosed diabetes. There's lots of folks out there that just haven't gone to a doctor in years. And so we like to catch those, and then we don't treat the diabetes at our clinic. We might get them started and then get them established with a PCP locally. Mm-hmm. So that's one thing we do. We spend a lot of time with our patients on education initially, and then we see them back for our Lose It program. We see them back every 3 months approximately to make sure that they're losing weight. At each of those visits, we talk about nutrition. We give them calorie goals. We give them protein goals. We want to make sure that they're implementing lifestyle changes with exercise and really working to improve their nutrition as they're losing, because the medicine, like I said, is a tool. It's not the main thing. And we really want them to come out, of this on the other side with much better habits and, overall, then they just feel better.
Sure.
And so.
That's great. Yeah, because we always see people in the gym, they have one piece or they have this piece, but they're not really sure how to complement that or, what their protein goals should be. And I feel like your business offers quite the comprehensive guidance through that for people who have these questions. Because, these new medications, they're just like you said, they're popping up left and right.
Yeah. I interviewed recently for a new provider, and one of the NPs we interviewed had worked at one of the national companies. And she told me that she does 68 follow-ups per hour for them. So that means she spends I don't know what the math is, 19 seconds per follow-up.
I was doing the math.
Yeah. A lot of these national companies, you just text in your information.
Right.
They just prescribe over text message. You never see a doctor. You never see a provider of any sort. They just send it right in. And that's not good care. It's not. It's really, really dangerous in my opinion. And I think these have to be followed by a provider. So
I was seeing that on your social media accounts, on your Instagram. I think you guys do a really great job of touching on that, because these medications are like a miracle lifesaver for a lot of people. And there are dangers to some of these medications. But if you have someone guiding you through this process, it's so much better. But there's scary things happening. Have you had patients that have gone through this? Have you seen patients who are hesitant because of this?
Yeah, absolutely. People who aren't being monitored, or there's also what's called gray market, if you've heard of that, where they're just literally ordering on the internet. Yeah. And it all comes straight from China, and could be made in someone's bathtub. You have no idea what's in it. And so, the most recent story I've heard about gray market, and it was the newest peptide that's going to be coming out for weight loss, the retatrutide, and he took 10 milligrams. The starting dose for our clinic is 1 milligram. He took 10 milligrams, decided that's not enough. I should take 20. And then forgot he took his 20, took a second 20, and then ended up hospitalized in kidney failure. And and there's the stories all over the place if people aren't being monitored. So
when you do work with someone and they come in and they have their goal and you've been through your program with them, that type thing, is it set up that is there a specific period of time that somebody is on the medicine? Is it?
It's really individualized because everybody's got, a different amount that they're looking to lose. Some people will, kind of do it in chunks. So our goal is slow weight loss. We want this to be long-term. We want it to be sustainable. We want this to be like the last thing anybody ever does to lose weight. So our goal initially, the first 2 weeks, I'm like, you might lose a little more, but then after that, we really want to keep it to 1 to 2 pounds per week.
What does the medicine do? Like, what is it? Oh.
Yeah, break this down for some people who may not be familiar and they're seeing, GLP-1, the term all over the place. Can you kind of break down what that means and what that medication is doing inside of our bodies?
Absolutely. So semaglutide is the first one that came out. That branded is Wegovy and Ozempic. And then the tirzepatide products came out. That is Mounjaro and Zepbound. And then, like I said, we use the compound tirzepatide compound semaglutide versions. And then retatrutide will be the newest one. It's not FDA approved yet. We're hoping maybe towards the end of the year, sometime next year, it'll be FDA approved. So they all work pretty similarly, but there are some unique things about each of them. So they block hunger receptors in the brain. So I don't know about you guys, but I used to pre-injection days for me. I would like wake up and think about breakfast, and then I think about
food
lunch.
Constant food noise is what I hear people saying the biggest impact is.
Yeah, I'd be like, what can I? Like I was in the hospital. I'm like,
dinner.
I'm thinking about it right now.
Yeah. Right. So yeah, I don't want it to take that away 100% for anyone, but I do want it blocked so that when you are hungry, you can slow down and make good choices, and you're not just home opening your cupboards like ravishing through. So, so that's one mechanism. The other thing it does is it slows down how quickly food moves out of your stomach. So when you do eat, you feel fuller for longer. So that results in obviously people eating less over time. And then the third mechanism, and why tirzepatide is a little unique, is it stimulates the pancreas to put out insulin only when there's a blood sugar spike. So initially when you're on the medicine, you might see a little more insulin put out, but then over time we should see insulin levels and blood sugar levels really going down and leveling out. So it's pretty cool. Retatrutide, which will be the next GLP that comes out, it has an additional mechanism, and it blocks sugar basically from being stored in your liver. So if you can't store it, you have to break down your fat and use your fat as energy. So it's in the preclinical trials kind of blowing away all of the other ones. So it'll be exciting. Really, I'm so excited about this because we've in the past never had real tools to treat obesity. And I mean, it is a true epidemic in this country and really in the world. So, we're on the forefront here of like probably being able to cure it. And then what happens down the line? There's 12 cancers associated with obesity. Those are all going to go down. Heart disease, stroke, like all the obvious things, sleep apnea, so many things. Yeah, diabetes, kidney failure. I mean, you name it, pretty much every disease system is going to be significantly improved from these medications. So
fantastic. That's so great. And I know you're talking about a lot of new medications, and there's so many new studies come out, and we're finding, new treatments and new uses for all these medications. But some of them have been around for a little bit. It's not how long has Ozempic been around in treating other things? Because I think some people may be cautious to try this new medication that just came out this year. But tell us, have these been in use for a while and they've been pretty safety tested? Yeah, so the first GLP came out in 2005, actually. It was called Byetta, and it was actually, they discovered it through the, I think, Gila monster. Interesting. So
what?
Gila monster.
Yeah.
I thought you said.
Yeah.
The poisonous, kind of funky looking lizard.
Oh, be darn.
Yeah. Right. I'll double check.
I remember them when this research started coming out used to treat diabetes.
Yeah. So the studies for that probably started late 90s. First one was launched 2005. Another one came around a few years later. In 2012, the first weight loss approved GLP came out. That's called Saxenda. It was a great medicine, but it's a daily injection. That's a little hard to talk patients into. And of course, with everything, technology has improved over time. So Ozempic came out in 2017. Wegovy, which is the same thing, but indicated for weight loss versus diabetes like Ozempic. That was 2021, I believe. And they
have a great memory.
Oh, gosh. They couldn't keep that on the shelf. I mean, you just couldn't keep it. It is now thankfully stocked, but couldn't keep it on the shelf. It was in shortage for years and years when it first came out. And then Mounjaro was 2023, and then Zepbound 2024 or 5. So Yeah, so they've come a long way. And then as far as the compound versions, I first became familiar in 2022 with them, but I assume they were compounding for some period of time prior to that. So
Interesting.
So you'd mentioned, we talked earlier about the cost, and there's been times that, I don't know, you start off saying initially there was something that was $25 and it was $1,200 or $1,400, or how does that, excuse me, how does that work for individuals? Is it an insurance-based thing that insurance helps pay for, or is that, again, case by case?
it's really case by case, and it's really one of the most discouraging things I think about all of this is access to these medications, and insurance coverage is terrible. So what most people don't know is actually your employer who decides whether to opt in or opt out of obesity care.
Okay.
So if they opt out, like no obesity drug is ever going to be covered ever, ever, ever. Now, if you have diabetes, you might get one of the diabetic drugs covered, but you're not going to get one of the obesity drugs covered. So we've seen since Wegovy and Zepbound launched, the insurance coverage has actually gotten worse over time. I think, and don't quote me, but the last statistic I saw on it was like 11% of insurance companies across the nation were covering Zepbound. So pretty poor coverage there. The pharmaceutical companies have brought the medications down in price over time, and now they have their own direct pharmacies that you can order through, or telemedicine companies they've partnered with where you can order it through them. But the average cost is still, for Zepbound, still around $400. So it's still very
Well, it's interesting you say that too about insurance companies, because the cost for that product has to be much more effective and efficient than the down the road healthcare issues that individuals will deal with.
Absolutely.
With potentially one of the 12 cancers. Or
But then what happens? Who doesn't make money? Insurance companies don't make money.
Yeah, no, I know.
Oh, got it.
Yeah.
They want us.
Like they would
Yes,
want to stop a
absolutely.
cascade of health issues, but
Yes.
in reality, they don't make money off of
Right.
healthy people. And that's not, I feel like almost saying that almost sounds like a conspiracy theory, but it's kind of just
My wife
how
and I talk about
business
that all the
works.
time.
Yeah. Yeah. Insurance companies do not make money off healthy people.
Right.
They just don't. So it's terrible, but it's what's happening. So,
Yeah.
and the pharmaceutical companies, I think, in my small opinion, I mean, they could certainly make these more affordable. They've made them somewhat more affordable, but the average person cannot pay $400 a month for their medication on top of, all the
Any
other things.
medications
Yeah. So,
and you're seeing this from both a provider perspective as well as a business owner perspective, which kind
Right.
of gives you this unique viewpoint.
right. So,
Well, and then when you combine that too with, first of all, if you eat less, there's some savings there,
absolutely.
but it's expensive to eat healthier.
Right. It is.
So
It is. I would say I hear from most of my patients that so our compound versions are more reasonable. They're still pricey, but they're a lot more reasonable than some of the brand name versions. So what I hear from most patients is, oh my gosh, I'm not going to Starbucks every day. My grocery bill is cut in half. I'm not dining out as much. When I do dine out, I actually get 4 meals out of it now instead of 1. So they actually come out money ahead, believe it or not.
Wow. So many things to go over.
Yeah.
It's kind of a gray space for so many people. Do you have any more?
no, that's all I had.
I know.
No,
I'm so
I'm
glad.
just-
Thank you so much, Jen, for coming today.
Well, I
because
guess
I feel like there's so many things.
Well, the process. Like, I know,
so
how do we find you? And then somebody, like, they go to your website, and if somebody was interested in
Yeah.
making contact, reaching out, and then is there something they fill out?
How does that work? Yeah.
Yeah.
What's the process for if they're interested and they want to, see about?
So we have a website, AspireHealth.care, not .com.care, and it's got all of the information on there. We try to be really transparent with our pricing, just so it's easy to understand. And yeah, there's a schedule appointment button or a contact button, and they can reach out, and we answer lots of questions ahead of time. We understand that, people really want to understand what they're getting into. Our initial weight loss visits, we do complimentary, so you can sit down, you can go through everything with us, and if you decide like, oh, not for me, you go on about your way, you don't pay anything. There is an enrollment fee for patients if they decide to proceed with care. And then we do everything through telemedicine. So there's a portal, there's a messaging portal, kind of like the local, hospitals have.
Yeah.
You can message your provider anytime. Our nurses are always following up, and we really do keep good track of our patients.
Yeah,
And
I have to say, full
Sounds like-
disclosure, as somebody who has gone to Aspire Health back in the day for the first time when I was looking into this, it's so responsive that you can just shoot off a quick message. It's not like you have to go into a physical appointment with your physician. Everybody that I've seen in your business is so responsive and excited to do what they're doing, and they're helping people.
Yeah.
So
we try to make it as easy as possible. So, and then from there, and then, like I said, once someone gets going with weight loss, they might realize like, oh, I want to add a peptide in. So we have all these other peptides that are kind of blowing up. If you're on the internet at all, you've probably seen something about them. So we're doing a lot of peptide care now, and then a lot of hormone care, and really, just aiming to make patients feel their best and live their best life. And, we're so happy and thankful to be doing it. So.
That's nice. Let me ask you this before we end here. Is there anything else something maybe that we didn't ask that is important? I mean, I think we've covered a lot, and you're really good at it. Just something that we would want people to know or hear.
Would have asked,
if not, that's fine.
One question.
Maybe something more about peptides.
Yeah.
Right.
Yeah.
Those are new and changing a lot. How are you guys navigating all of the things coming in and utilizing that information to help patients the best?
Right. Yeah, it's been a challenge, but some peptides have a lot of research on them. Some don't. Very few are actually FDA approved. So we've really worked hard as providers to educate ourselves and learn, everything we can about these. We have specific protocols set up with, varying options so that we can tailor that to our patients' needs. Some of the popular peptides right now are Glow and Clo, which contain several peptides: BPC 157, thymosin beta 4, and GHKCU, which is like the kind of the beauty peptide, if you've heard of it. So BPC is really good for like healing and repair. Its kind of sister is Wolverine, which we've used so much for chronic pain or acute pain issues. So I've got, a guy in Maine right now who had rotator cuff surgery last summer. He's been in PT still and really suffering, and got him on the Wolverine. And I just checked in with him, and he was like, I am falling over. I cannot believe how good this feels.
Oh, that's awesome.
Yeah, it's been great. A younger guy I've got up in South Dakota has had some congenital hip issue forever, was scheduled to have surgery in May. He just finished his second round of Wolverine and is going to put his surgery off for a bit because he's feeling so much better. So the peptides are exciting, and as long as you're doing it carefully and under medical supervision, I think they're the wave of the future. Like, I would much rather take a peptide than go into my doctor's office and get a handful of statins and blood pressure medicine and who knows what else.
Possibly surgery.
Jenni, thanks so much. Asked a good question, and now we ran out of time. So appreciate it, and thanks for joining us. See you next time.
Thanks.
Thank you.